My name is Matthew Johnson. I'm a medical gastroenterologist and also a general medical physician. From my perspective, it's a dustbin diagnosis. Essentially, people present with symptoms, and this frequently gets labelled as IBS. And sadly, when someone's labelled with IBS, it's like a pungent aroma, it just kind of sticks, and nothing progresses from there. And so a lot of these patients have a lot of symptoms and never really get an explanation, and therefore they never get targeted treatment. There are a couple of simple investigations, whether it be blood tests or stool tests, to at least exclude the worrying pathology and some of the bigger conditions like food allergies, celiac disease, non-invasive tests. And then people need to move on from that and do functional tests to actually take a look at the way that the bowel handles stool and air, because we pick up different things, and those different things can be managed in different ways. Bloating is typically air, either too much air coming in, too much air being created, or air that's trapped behind firmer stool around the bowel. With regard to altered bowel habits, obviously people worry about cancer usually, and so there are some simple non-invasive things, and obviously there are things like colonoscopy that can exclude that. And with regards to pain, there are physical reasons why some people get pain. One of the best methods of assessing that is CT scans. A lot of what we do is to try and isolate down which is the key issue. Is it the air? Is it the stool? And then try to improve that, sometimes by just softening things. That can come down to increasing the amount of fluid someone drinks, slight changes in the diet, more towards a high soluble fibre diet. And then there are osmotic agents, which are a sort of novel or modern laxatives. Rather than greasing the tube, as it were, to help things slip through, they soak fluid up into the stool to soften and bulk things up and get things shifting more completely. There are obviously some warning signs that we do get a little bit worried about, such as seeing blood mixed into the stool, constant nausea and vomiting, indigestion issues that are not being controlled with simple anti-acid tablets, weight loss, vomiting of blood. If anemia is picked up, especially iron deficiency anemia, picked up in blood tests, and there's bowel symptoms, yes, we'd always recommend someone comes in to get those checked.